Today, I want to discuss how functional medicine is different than conventional medicine. And I want to do that by comparing and contrasting the two. But I also want to paint a clearer picture by discussing a former client of mine who had been down the conventional route for over 10 years. She had chronic health issues, was taking more and more medication, and wasn't getting any results. In fact, it was actually getting worse. So, about a year ago, she decided to think outside the box and gave functional medicine a try. Stick with me until the end, and you'll get to see the benefits that she received in a relatively short amount of time. Functional medicine has also had a huge impact on my life, taking tons of antibiotics when I was in high school and college for acne, not realizing what it was doing to my gut, left me with lots of gut issues that I've thankfully been able to address. My father is type 2 diabetic. My mother has Hashimoto's, as does my wife. So these are autoimmune conditions, and frankly, functional medicine has had a great positive impact. So I'm happy to share this information with you. So let's dive in. It comes down to different paradigms. Okay, so conventional medicine is superficial. It's looking to kind of mask or cover up the symptom. You go to your doctor, you discuss how you're feeling, discuss your symptoms, and you're going to get a medication matched to that. Versus functional medicine, it's investigative. It's looking to get to the root of that issue. Instead of just covering up the end result, covering up the symptom, we're trying to get to the root of the issue, looking upstream. Why is your blood sugar elevated? Maybe it's because you're consuming too much sugar. Conventional medicine is dualistic, meaning that it looks at the body in separate components or compartments. So we've got digestive issues, we've got blood sugar issues, we've got neurology and brain types of issues, and it separates this out, and it never actually looks at the body as a whole. It's one functioning unit. All right. Versus the functional medicine model is holistic, looking at the body as a whole. That's so important. There's so many things on a foundational level that must be done to give the body good nutrition, give the body really what it's looking for through nutrients and healthy lifestyle, food and diet. These things are so important. Side effects. I mean, you've seen the medication commercials, right? There's a long list of side effects. That's all we'll say. Functional medicine is very safe, mild to no side effects. Okay, with functional medicine, again, we're supporting natural physiology. So we're giving the body what it's looking for, as opposed to trying to cover up a symptom. Conventional medicine is disease-centered. So, if they realize that it's a thyroid issue, say hypothyroidism, there's certain medications that they're going to match to that condition. If it's diabetes, it may be metformin. If it's hypothyroidism, it may be levothyroxine. But regardless, you're kind of put in the category or the pool of that condition. So again, hypothyroidism goes in the hypothyroid pool, and you get the same medication as everybody else. Versus client-centered, patient-centered, we got to focus on the person and not the disease when we're discussing and thinking about functional medicine. All right, so yes, there may be a condition or a diagnosis, but functional medicine has to dive deeper and figure out why. Why are they having this? Focus, talk to the person, discuss, stress levels in their life, discuss what they're eating, discuss, how much they exercise, what do they sleep, are they staying hydrated? These are, again, ways that functional medicine dives deeper. Conventional medicine is pretty limited, mostly drugs and surgery. That's about all your insurance card will cover is drugs and surgery, versus an integrated approach through functional medicine. Again, we're going to discuss food, nutrition, lifestyle. What are you eating? Are you exercising? If you're not, if you've never exercised, where can we start? Okay. Food, oftentimes I find food makes us feel better quicker, and then exercise is kind of the next cherry on top, if you will. It's the next step in the natural progression to get to ultimate health. Lifestyle, we've got to talk about stress levels and things like that to achieve optimal health. Reactive, so conventional medicine is fairly reactive. It waits until there's a problem, it waits until something is broken, and then it tries to fix and just manage, typically with medication. It's just not a very empowering way of doing it. Versus functional medicine, it's preventative, and it's based on what Hippocrates said many, many years ago. Let food be your medicine. So again, having a proactive and preventative approach, doing things that medical research has shown to have amazing benefits on your life, like eating the right foods, avoiding the bad foods, avoiding inflammatory processed foods, managing your stress, drinking enough liquids and water, getting enough sleep. These are all really, really important when it comes to achieving optimal health. Okay, I love this slide. It's a great just picture and overview. I'm a visual person, so here you go for all you visual learners. All right, so on the top we have certain conditions or certain diagnoses. And many times what I've found is that people get passed around year after year, and then finally they get a diagnosis. Okay, this can be very frustrating. It can be difficult because you have the symptoms, but nobody's giving you the answers. All right, so anxiety, depression, thyroid issues, autoimmune disease, diabetes, these are real things that people deal with. But again, once the doctor finds out what's wrong, typically it's a medication or maybe multiple medications. Okay, versus the bottom here, the roots, getting to the root of the issue is what functional medicine aims to do. So we are going to discuss things and look at markers, dive deeper with functional testing. So we want to see, is there inflammation in their body? We can look at markers like C-reactive protein to gauge inflammation. We're going to talk about stress. If a person is under a lot of stress, whether it's job, financial issues, or stress in the form of digestive issues like IBS or inflammation, they have to be addressed. Okay, poor diet is huge. We've got to help folks understand what to eat. Digestion, we must digest and absorb our food. So you can see here all of these things: genetics, lack of exercise. We've got to get to the root of the issue. Many times it's multiple things that are happening in a person's life. It's not just one. Okay, but by having conversations, diving deeper, we can develop a clear and conscious and confident game plan moving forward to address this person's underlying issues. Okay. So again, a better approach, the conventional model versus the functional medicine model or the functional medicine paradigm, I strongly feel and would take it to the grave. The functional medicine model is just a better approach. So let's talk about this former client of mine who went through the conventional medicine route for over 10 years, dealing with chronic hives, dealing with weight gain, fatigue, and reflux, digestive issues, gas, and bloating. So let's talk about how the two models would address a person like this. And again, this is a real life. I'll show you her written testimonial here in just a few minutes. But again, what she was doing first, what everybody's used to, the conventional model, chronic hives. She was diagnosed with chronic hives, chronic urticaria, and was put on cyclosporine, which is an antibiotic. Okay, it helped a little bit, but it was totally devastating her gut being on that antibiotic. Again, versus the functional medicine model, chronic hives is often autoimmune. We must not focus only on the skin in this case. Even though that's where her symptoms and everything is showing up is on the skin, we have to look at her immune system, which mostly is found in her gut. So we had to focus on her gut. We did a GI map stool test and discovered some imbalances that we had to address. reflux, gas, bloating was something she was dealing with on a daily basis. Poor diet's a part of that. She was put on Protonix, which is super common. Most of the people I talk to are on, an antacid type of medication. So again, trying to cover up the symptom. You get heartburn, there's a medication. Now, versus the functional medicine model looks at it and says this is 95% of the time related to food and what you're eating. If you're consuming inflammatory foods and you're not chewing your food well, you're going to have digestive distress, reflux, gas, bloating, and then oftentimes we have to support digestion with certain enzymes, digestive enzymes, and even hydrochloric acid, which is typically depleted in the stomach. She had joint pain. She was put on Zoloft, which is an anti-inflammatory. Again, joint pain, those joints are inflamed for a reason, and what she got was an anti-inflammatory. What we know is that we can check inflammation levels. We can check inflammation levels in the gut, but also in the joints, and found that she did have high C-reactive protein in her blood marker. So we had to do some things, give her some natural anti-inflammatory relief like omega-3s and resveratrol and a few other things to bring down inflammation. She was fatigued, had brain fog on a daily basis. Doctor said rest and de-stress, which that's not bad, rest and de-stress. But there was never any follow-up. There's never any advice or actual steps that she could take to do that. Whereas we realize fatigue and brain fog is often related to gut. If your gut's on fire, your brain's on fire. There's definitely nerve associations and between the gut and the brain that have to be calmed. It's usually where it's starting in the gut, that fire or that inflammation, and it progresses and carries over to the brain. And so you have to typically look to the gut, and then you have to digest and absorb. Everybody's heard you are what you eat, but that's only partially true. More importantly, you are what you digest. Okay, so again, you can be eating all organic. You can eat, all organic fruits and veggies and meats, but if you're not digesting, breaking them down, and absorbing them in your gut, this is a big issue. Okay, and there's great testing with stool testing and other organic acid tests that we can utilize to, again, figure out where these imbalances are coming from. She was gaining weight. They said exercise. I don't disagree with that, but there's never really any follow-up or any steps that she could take or any accountability there. And of course, I've seen, working with many, many people, that food and what you're eating is so much more powerful and beneficial than spending hours and hours in the gym. Now, you may love to exercise and you may want to spend a lot of time in the gym, and that's great, but food and what you do in the kitchen is more powerful and has longer lasting benefits and improvements. Okay, now here she is. Her name is Libby, and she was so kind to leave a review on my Facebook page. And here's what she had to say: no more hives. Okay, this was just about 3 months after she started a functional medicine program. Now, she had been about 10 years. She had chronic hives for 6+ years, but had these other health issues going on and wasn't getting anywhere. And in 3 months, no hives. Had chronic hives for over 6 years, on several medications for them, but still hives every day. I finally looked outside traditional medicine and found Dr. Jones. He got to the root of my illness with extensive blood and stool tests and started me on supplements that healed my gut. Got to restore and give proper function back to the gut. It's so, so important. Also got on a gluten-free, sugar-free, dairy-free diet, and again, the results: no more hives. She lost weight, she's energy, and she's off all of her medications. That's amazing. Thank you, Dr. Jones. So I just want to be clear, I'm not the one that takes you off your medication. I don't adjust or alter any medication. That has to come from her medical doctor or your medical doctor. I simply look to support natural physiology and figure out where these underlying issues are. And hopefully you have a better idea of that process today. If you have any questions, feel free to reach out. I'll have my contact info in the comment box below. I appreciate you watching. If you know somebody that could benefit from this functional medicine process, it's a paradigm, then please tell them about this video, have them watch it, send it to them, tag them in the video. Have a great, blessed day.